Can you tell an ordinary people who have no idea about healthcare reforms, what's going on in Washington D.C. for a layperson who have,
I would say there's two or three basic things that are going on in healthcare reform right now. One is Congress is crafting legislation to expand various kinds of insurance coverage that will be available to people and businesses, either private insurance or public programs or employer-based coverage. The second thing that's going on in healthcare reform is there's lots of stuff that's going to make our healthcare delivery system work better, work more efficiently, cost less, improve quality, improve access to services that's sort of separate and distinct from insurance coverage itself. So those are sort of the broad areas that Congress is trying to address in the legislation. The American healthcare system relative to other advanced countries is very inefficient and very much in need of reform. It doesn't work very well, both for insurance and for delivery of services. And so this is an issue that's been crying out for reform for decades now, and Congress is finally getting around to putting some major reforms on the table. It won't fix everything. It'll fix a lot of things. It will establish a new platform in America, and then we'll build on that over time. It won't be over.
When we said there are 40 million uninsured people in the country.
46 million.
46. Who those 46 million people are?
80% of them are in families where one or more member of the household works. So they're working people. When you look at that in terms of age categories, it's young adults and it's older adults that are not yet retired, that are not yet eligible for Medicare, our national program for older people. When you look at racial groupings, racial and ethnic groupings, it's much more people who are members of racial and ethnic minorities than in terms of the majority white population. Those are some of the characteristics of who doesn't have health insurance. Also, it's people who are fairly low income, under 200% of the poverty level. Two-thirds of the people who don't have health insurance are under that, which would be about $22,000 for an individual or $44,000 for a family of four. So when you look at those sort of categories, often tends to be people more in highly concentrated urban areas or rural communities. In terms of geographic areas, can often determine whether you have access to insurance or not. So those are some of the demographics around who doesn't have health insurance.
So the version which was passed by the House,
yes,
that version covered how many out of those 46 million people?
The House is estimating that of the 46 million uninsured, 36 million will get coverage through the bill that passed the House.
And what about the rest of the 10 million?
Yeah, there will be 10 million that still won't have direct access to coverage. They may have indirect access, but they're estimating that 36 million people will get coverage.
And can you tell us what is this public option mean?
Public option would be an insurance program that would be available to people and businesses and employers. It would be offered by the government instead of a private insurance company.
And this option is the part of the bill passed by the House?
By the House. And something similar to Medicare. People know what Medicare is, something like that.
Right. And can you tell us when this bill is going to be for voting in the Senate?
The Senate will begin its debate the first week in December and will last for 2 to 3 weeks. Then they will finish their debate. Then the House and Senate leaders will have to meet to work out differences between the House version of a bill and the Senate version of a bill. They'll come up with a common version that they'll all vote on, and then the President will sign the bill. And hopefully that will be done before the end of the year or right after the beginning of the coming year.
And Mark, there are more than 12 million undocumented immigrants in the country. Are they being covered in the proposed healthcare reforms or no?
Not really, no. Things are pretty much going to stay the same for undocumented immigrants. They will still have access to emergency Medicaid in an emergency room in a medical crisis, as they do now in New York. And they may have access to these new exchanges that will be set up, the National Insurance Exchange, to purchase coverage through the plans available in that exchange. That's being debated right now. We're trying to make sure that they will have access to those plans nothing is definite yet.
So how do you think the communities could play a role for their,
It's very important that both citizens and non-citizens speak with their members of Congress about this issue, and now is the time. In another 6 weeks or so, it will be too late. The bill will be done. So now is the time, and also to work with other community groups in your area that are working on this issue, so that you don't feel like you're working alone. They have people that understand these issues that can help you understand them, help you get involved in various activities that are going on to make sure that immigrants get a good deal out of health care reform and are not left on the sidelines.
And are you satisfied with the version passed by the House?
Overall, yes. There are some things that can be improved. There are some things that need to be taken out of that bill. There are things that need to be put in that weren't put in the first place. But overall, we're very pleased with the bill. Millions of Americans will benefit by this.
What needs to be taken out?
Well, particularly the restrictions on comprehensive reproductive health care for women and in particular abortion-related services, the limitations on that. That needs to be taken out.
And what needs to be added in the...
I think we want to see a stronger version of the new public health insurance option. The House did include it in this bill. It's sort of a modest version of it. We'd like to see a better version. We'd also like to see provisions included that would allow states to go beyond federal health care reform, particularly to comprehensive public programs that might be available, so-called single-payer national health insurance model.
And now can you tell our viewers, what do you mean by single payers?
A single payer is a technical term of the insurance industry where there's one payer. Many countries have a national health insurance program where the government pays for health care through taxes. That's what's meant by a single payer proposal. The government would be providing the insurance coverage for everybody.
Right. Thank you very much. Thank you.